The Attorney General of the state, J.B. McCuskey. J.B., good morning. How are you, sir?
What's up, fellas? How we doing?
We're doing wet is how we're doing. Are you getting the rain we're getting in Charleston?
I'm actually on my way out to the to D.C. today.
Oh,
so
yeah?
I'll be driving through all that wet weather, yeah.
Yeah, what are you doing?
We got a couple things. I have a TV interview we're doing tomorrow, and I got a meeting with some folks in Shepherdstown on my way out to D.C., and then the sort of main events, we have a roundtable meeting with General Bondi at the White House on Wednesday for Police Week to sort of talk about the task force that we have helped her sort of establish, myself and about 25 other AGs, as well as other sort of law enforcement issues and ways that attorney generals can assist the U.S. Attorney General and sort of turning the tide on public sentiment as it relates to law enforcement officers, right? Like we've seen over the last 10 years, especially more so when we have Democrat presidents, but there's a sort of side eye seen towards the law enforcement community in its totality. And, you know, we believe that we should be revering our law enforcement officers and, you know, working to make sure that we solve small problems that exist and good cops, there are far more than there aren't, believe the same thing. And so it's really about finding the best voices for the best practices and supporting our law enforcement officers every day. And that's what we're going to be talking to the Attorney General about. And then on Thursday, we have an argument in the U.S. Supreme Court about an amicus that we filed limiting district court judges' ability to issue nationwide injunctions, which is an incredibly salient and important topic. And our solicitor, Michael Williams, along with a group called the American Center for Law and Justice, wrote what I think is the premier amicus in this case, and we're excited to go hear the case get argued.
So, backtracking one point.
I'm a busy bee.
I would
it's
say.
a long couple days over there, yeah.
Yeah, we just had the chief of police from the city of Martinsburg on. He said within the last year they made 29 new police hires. So I think
love that.
Maybe the attitude is turning because for the longest time it was hard to find people to get on the police force.
Yeah, and we live in a state where people understand law and order, believe in law and order, and want to ensure that one of the government's main functions is protecting families and businesses from those that want to do them harm. And people in West Virginia, by and large, I think understand the danger that police officers put themselves into and respect probably more than any other place in the country the sacrifices those men and women make to make sure that our communities are safe and vibrant and places where, you know, we can maybe leave the door unlocked and let our kids walk to school and we don't have to worry about our businesses having bricks thrown through them and people looting. So I think that it's one of our great advantages here in West Virginia is that as people are looking for where to move, public safety is a wildly important metric that families look at. And we live in a place that I think is as safe as any place in the country and a place that understands why that is. And that's because of our great men and women in law enforcement.
You mentioned task force that you were part of putting together. Is this the Second Amendment task force, JB?
Yeah, and we weren't part of putting it together. That we don't need to go that far. We were a large group of attorney generals helping our U.S. Attorney General after she put it together. You know, sort of show support for her efforts and to make sure that they understand that they have outposts throughout the country where these kind of task force can be effective.
What is the work of the task force?
Well, we're going to find out a little bit more about that, I think, on Wednesday. But I think the overarching goal is to ensure that we have law enforcement officer input on how are we going to make sure that we are supporting the Second Amendment and ensuring that our law enforcement community is part of that conversation, and how we can start to get illegal guns off the streets in places where guns are banned, right? I mean, the places where you find the most gun violence are the places where it's the hardest to get a gun. And I think law enforcement officers understand that, and I think that is a paradigm that needs to be solved, is how do we use the ideals of the Second Amendment, the idea that law-abiding gun owners are one of the great sort of just the data will tell you it's one of the great hedges against gun violence. And how do we make sure that all of our youth are trained, if they want to be firearms owners, that they are great firearms owners. They understand how and when to use a firearm, and they understand the dangers of those things, and that we can ensure that everyone is able to enjoy the broad reaches of the Second Amendment while also ensuring that our law enforcement officers are kept safe from those who wish to use guns illegally.
And Matt, that does not include shooting a squirrel's nest out of a tree, by the way.
I was 14 on that hunting trip.
Matt, one might have used a leaf blower.
It was high up in the tree. I couldn't have got it with a leaf blower.
A really powerful leaf blower might have done the trick then.
Yeah.
Hey, let me ask. I know at least sometimes in my own mind when I hear the Attorney General or just AG or AG's office, I tend to think of your office more obviously along a statewide dealing with even national issues and how they affect our state. How does the AG's office work in support with local law enforcement? A lot of what you're talking about right now is right down to the streets here in Martinsburg and other cities and counties across West Virginia. How do you all work together?
Yeah, so interestingly enough, coming from the state auditor's office, we worked incredibly closely with our county sheriffs in the auditor's office. And the way that our AG's office here is set up is we don't have hardly any criminal authority. But what we do is we are the lawyer for the state in any case that gets appealed. So if a criminal is convicted in a circuit court, indicted and convicted in the circuit court, and they appeal that ruling, the Attorney General's office then steps in and represents the state to ensure that the court's determinations in that hearing are upheld at the Supreme Court. And I think the other part of what the Attorney General does is to make sure that the laws that the legislature passes that are intended to support our law enforcement officers, be it from their pension standpoint or from the safety standpoint or you name it, anything that our state government is doing to work to help our law enforcement officers, it's our job to make sure that those laws are found constitutional. And so because of that, we are sort of by name alone a place where people look to sort of understand and to lead on what should be our state's thought process around law enforcement, and we take that very seriously. And we are, I am just personally, I have a significant reverence for our law enforcement community. My father-in-law was a policeman in San Antonio for 30 years, who happens to also be from Mercer County, West Virginia. But I've sort of been surrounded by law enforcement people in my life, and the sacrifices that they make are it's hard to really quantify, right? I mean, they come home after having a hard day's work is a day where they see things and have to do things and be around things that are hard to see and be around. And, they wake up every morning ready to do that on our behalf. And, for me, there's no more important way to serve our community than that.
All right, let's talk about the Pfizer settlement if we could, JB. Then I know that Jonathan Bott will have some questions for you as well. Tell me about the Pfizer settlement, $3.5 million.
I thought you were going to ask me a question. I was waiting for you to ask.
Yeah, here it is. Here it is. Can you tell me about the Pfizer settlement?
General Morrissey filed these claims when he was the Attorney General, and a guy named Doug Buffington, who was one of Attorney General Morrissey's main deputies, settled this case right before we took over, and we are going around distributing these checks that came from Pfizer to our local governments in hopes to sort of direct them into using this money to help offset PEIA costs and to ensure, as we did in the auditor's office, this money is getting spent on things that are going to have sort of a lasting and meaningful effect. But the underlying facts of the case were that Pfizer slow-rolled the end of the primary drugs, Lipitor's, lifetime. And so we all know that there's a certain amount of time that the name brand drug gets to be sold without any generics being on the market. And they gave themselves an extra, I believe it was 18 months where there were no generics on the market. That cost the state and PEIA and our consumers several $1 million. And we were able to settle with Pfizer to rectify that, and the money is now being redistributed to those who were harmed. And in this instance, it's our cities and our counties.
How did you determine how much went to what city and what county?
Yeah, Yeah, it was all based on population, right? So, Martinsburg's going to get a little bit more than Charlestown. And so it's just a formula. It's a total number divided by people, and then the checks are cut based on that formula.
Per capita. Mr. Bodwell.
Per capita, that's right.
Per capita.
You sound like a lawyer.
Oh, I never went to law school.
using those big fancy Latin words.
Per capita.
He doesn't even play one on TV.
I did watch L.A. Law a lot when I was a younger man.
That was a good one.
I like that
L.A.
show.
Law was good.
Oh, yeah.
Victor Cifuentes.
That was the one with Corky, right?
Yes.
He was the best character. I remember there was an episode where Corky got married, and it was the cutest thing in the entire world.
That's cool. It's just we're all showing our age here, JB.
I know.
Let me go back to drugs. The police chief we had on a little while ago, he mentioned a couple things we'd never heard of.
John, I have to interrupt, Jonathan. You can't ask the question. Don't go back to drugs, Jonathan. Stay off of drugs.
Well,
It's just the way you worded that.
No, but
This is your brain on drugs.
let's go back. No, he talked about pink cocaine and something called boot, I believe.
Yes.
Are we seeing, I mean, I know the state got a lot of money in the settlements from the drug companies, and I know that was spread around. Are we seeing a downturn in who the state's able to go after as far as these problems? I mean, is that sort of being rectified, or are there still other big manufacturers that we are in the process of suing to try to make a lot more people in West Virginia right?
Yeah, so I think that you asked sort of two different questions there. Pink cocaine is not generally manufactured by Pfizer.
Oh no, I wasn't saying
So
that. I'm just saying that there's always an evolution
Correct.
in drugs.
Yeah, and I think what we've seen now is that the drug companies have had their hands slapped real hard, not just by West Virginia but by states all across the country. And I think there isn't going to be a Purdue Pharma anymore as a result of these lawsuits, right? Purdue won't exist, which, if I'm being honest, is a great thing. Purdue turned into a criminal enterprise that sought only to harm those that they didn't care about. And their demise is, in my eyes, a great thing. But the drug companies they're not acting the way that they used to. And so that means that we have now sort of solved this problem. Solved isn't exactly the right word, but we will never completely solve the problem. But the drugs that addicts are using for a myriad of reasons have gone back to street drugs, which means that now we're fighting criminals again as opposed to criminal manufacturers. And, it's people that want to do drugs or people who end up on drugs. There's a common causality to these things, right? And there's a hopelessness to drug addiction and to alcohol addiction that can really only be solved by lifting up the communities, right? Lifting up the hopefulness of the communities, lifting up the economy, lifting up our schools, and showing kids that there is a life to be lived that is free of drugs, that is incredibly beneficial not just to them and their families, but to their community at large. And so that is what this $1 billion fund that was created from the opioids is designed to do. There's a guy named Jonathan Board, who I think you guys have had on the show, who runs the West Virginia First Foundation.
Yes.
And they are trying to find, the most unique and advantageous ways to utilize this once-in-a-generation funding to ensure that we have significantly less kids getting addicted than we have now. Right, helping people who are already sick is incredibly important, but it is the second most important function of the First Foundation. If we are dealing with the same percentage of people in this state who are falling prey to drug addiction in 10 years, we have failed. The only way we can stop this is if we have to stop the bleeding first, right? We have to have less people that we need to help in the future, right? Or we're just riding a bicycle in a circle. And so that is really what we have to start saying to these kids is that if you get a great education and you really focus on how do you use your life to not just make yourself, but to make the people around you better, you're never going to want to be on drugs because you're going to wake up in the morning excited to go to work and excited to kiss your kids and to go to church on Sundays and to, go do whatever it is you love to do, ride a dirt bike or play golf or do whatever it is. But that hopefulness needs to exist in West Virginia the same way it does in so many other places that don't have the same issues. And to me, that is the single greatest function of the First Foundation. And I'm really excited about the work that Jonathan is doing, not just on that realm, but also on how do we find the best ways for people that are already suffering from substance use disorder to get back to a real life, to get back to their families, to get back to their employment, and to find a pathway to happiness after drug addiction. And I just think we've got the right people in place, and I'm really excited about what they're doing.
Let me ask another question, a completely different question. Now that you've had time to settle into the role, what do you see as the most important issue that you need to tackle, that the AG's office needs to tackle here in West Virginia that has not been tackled yet?
Wow, that's a great question. So we have a series of cases, and I can't get into them exactly, that are in the sort of the healthcare delivery realm. And as everyone sort of knows here in West Virginia, healthcare costs have skyrocketed. And there are a group of people that are in the sort of quasi-health insurance area that have sort of squirreled themselves into a key role, and we believe are acting very unscrupulously, and their role in the healthcare delivery system has caused these costs to skyrocket in a way that, but not just from prescription drugs, but also in healthcare delivery. In the next month or two, we will be sort of explaining, what are these cases that we're going to file, what they mean, what their value is, and how we think they're going to lower both prescription drug costs as well as healthcare delivery costs for every West Virginian. And that was a very specific example, but I think the most important thing that we need to be working on right now is making sure that everyday West Virginians have the ability to live and afford the life that they have. And we're seeing prices coming down every single day, but the idea that our health care is 20% of our income it's unsustainable. And it's a system problem, and it's something that we're looking at solving.
Is it pharmacy benefit managers you're talking about?
It might be, but you're an awfully smart fella. All I can say is that that's a really good guess.
Well, and I know our state is not the healthiest state. I mean, everybody knows that. But, I mean, I own an insurance agency. We do a lot of health insurance and Medicare. On the individual health insurance side, the premiums are so much higher in West Virginia for people who want to buy health insurance than they are for people in Maryland, Pennsylvania, or Virginia, or surrounding states. And something really has to be done with that.
Yeah, and I think the other issue that we have, especially in the health insurance realm, is that our payer mix is awful. We are somewhere in the 90-10 range, and for the people out there that may not know what I'm talking about, roughly 90% of West Virginians are on some form of a government-provided health insurance, be it PEIA or Medicare, Medicaid, TRICARE, you name it. And only about 10% of West Virginians are on private health insurance. And what that does is PEIA negotiates rates that are lower than private health insurance with hospitals and healthcare providers. And so what that then does is it makes it very difficult for hospitals to make their ends meet, which then ends up at the end of the day raising the cost for everybody, because then the private insurance is having to cover more of the load. And I think that's probably why the premiums cost more. I haven't really looked into it, but my guess is that's a key driver in that metric. Is that correct?
I would have to agree with you. I mean, the private insurer doesn't have as much power because they have such a smaller percentage that the hospital systems and everybody, I mean, they need to make money too. They've got to break even and keep the lights on also. We're caught in quite a quagmire.
And they're having a really hard time doing that.
Yeah, they are.
As you're seeing PEIA premiums increase, what you're really seeing is they almost have to be increasing because so many people are on PEIA that the hospitals cannot get to that neutral point where you're talking about at the rates that were negotiated before. And we think that the groups of people that we're looking at filing some actions against here, when we start to remove the sum of these groups from the sort of middleman part of these transactions, we're going to start to get back to the real cost of health care, right? The not these inflated numbers that are based on, how much can we end up settling for, but what are the actual costs? And that's going to lower the cost of health care for everybody. It's going to lower premiums on the private side. And I think the most important thing here, though, is that we have to start growing the economy in West Virginia and adding people who have private health insurance, right? We have to, the payer mix needs to be something like 80-20, not 90-10. And what you're seeing with things like Nucor and with the Procter & Gamble plan, and there's so much excitement around West Virginia energy and West Virginia's manufacturing sector, it really feels like this is starting to happen. And I think it's going to be a super important 8 years, not just from the AG standpoint, working on the functional legal level, but how is our economy going to raise up, and how are we going to start to add these kind of well-paying private insured jobs throughout the state to take the burden off of the PEIAs and the Medicare and the Medicaid.
JB, we have 2 minutes left. I wanted more time for this, but you're going to have to squeeze it in. KC Transport sounds like a nightmare scenario for this trucking company and their legal fees.
Yeah, and this is a pretty simple one. I can squeeze this in 30 seconds. The federal government frequently tries to tell people what to do when they're not allowed to. In this instance, MSHA got a little too big for their britches, and they have told just a regular trucking repair company that they are part of an active coal mine, and went in and regulated them and fined them. And we believe that that is an egregious overstepping of MSHA's authority, and we are really proud to work on this case to make sure that this action is remedied. There's a guy named Chris Pence down here in Charleston who filed the underlying action. His legal work was outstanding, and so it was really easy for us to step in and support this trucking company and everybody throughout the country, honestly, who's tired of federal regulators coming in and saying and overstepping their bounds and making it more difficult for small businesses to make money and to employ West Virginians every day.
This is a repair shop that works on trucks, but it's not a coal mine. Why were they being treated as a coal mine? 20 seconds.
Because MSHA wanted to regulate them. There isn't really a great answer to that. It was just an overzealous regulation by the federal government, and as we've seen over the last 50 years in this country, federal regulators, when left unchecked, will push the boundaries of their authority, and it's up to attorney generals to make sure that doesn't happen. I'm
going to send you out with the L.A. Law theme just for the heck of it. J.B. McCuskey,
thank you. I love it.
Yeah, there you go. Susan Day, who doesn't, right? Hey, have a good day, sir.
Hey, thanks, guys. You'll have a wonderful day. Thanks for the time.
Thank you.
Attorney General J.B. McCuskey.